Hello, this is Mary Atkinson, demonstrating some of the techniques from my book, Healing Touch for Children. The diaphragm line follows the lower edge of the ball of the foot, running from one side to the other side. If you bend the toes towards the underside of the foot, you'll see the natural crease that's formed. Gentle rocking movements along this line can have a wonderful, relaxing and reassuring effect. Diaphragm rocking is included in many of the sequences in my Healing Touch for Children book. Solar plexus soothing is a wonderful technique to help your child relax. The solar plexus points are found on the hollows in the centre of the diaphragm line on both feet. Hold these for the count of 3 and then release. Ask your child to breathe at the same time, breathing in and out as you hold and release these points. My book, Healing Touch for Children, includes cautions and guidelines for using these reflexology techniques with children. The head is a padded area of the big toe on the underside of the foot. Walk or stroke over the area, covering the whole of the padded area. The brain reflex is right at the top of the toe. Hold or circle on this point. The brain reflexes are also found on the tops of the next 2 toes. The neck and throat are on the base of the big toe on the underside, top and sides of the toe. Use your thumb or your finger to walk or glide all around the base of the big toe. The sinuses are on the backs and sides of all of the toes. Depending on the size of your child's toes, use your thumb or fingers to walk, glide or squeeze up and down the backs and sides of all of the toes. Start at the base and walk upwards. Eye reflex points are found on the ball of the foot under the first bend of the second toe. You can either make circular moves or hold. The ear reflex points are found on the ball of the foot just under the first bend of the little toe. Use the same techniques as for the eye reflexes, with circular moves or holds. To work your child's back, start at the inner edge of the big toe and use your thumb to walk or glide down the edge of the foot, always moving in a forwards direction. Although not shown here, if you choose, you can change hands and walk back up to the big toe. The lungs are the large padded area known as the ball of the foot. Use your thumb to walk over the whole area. You can work from the diaphragm line upwards or across the foot, as you wish. Always keep the foot well supported with your other hand. The diaphragm line is integral to many of the sessions in my book, Healing Touch for Children. It's a line that follows the lower edge of the ball of the foot, running from one side to the other. If you bend the toes towards the underside of the foot, you'll see the natural crease that is formed. This is the diaphragm line. Use your thumb to walk or glide along the line, working from one side of the foot to the other side. Keep the foot well supported at all times. The liver and gallbladder are found just beneath the ball of the foot, mainly on the right foot. Use your thumb to walk or glide over the area, working from the outer edge to the inner. Although not shown here, you may choose to change hands and work back in the opposite direction. When working at home on small feet, it tends to be easier to work the large and small intestine together. They're found in the middle of the sole of the foot. With the foot well supported, use your thumb or your finger to glide or walk over the area, working from one direction to the other and then swapping hands and working in the other direction. The bladder reflex is a soft, puffy area on the inside of the foot. Use your thumb or finger to walk or glide over the bladder reflex and then up towards the kidney reflex. Keep the full foot well supported with the other hand. The adrenal reflex area is just found above the kidney reflex. Support the foot and use your thumb to press on the reflex or to make gentle circling action. Always use a light touch here. The spleen is found on the left foot, just beneath the ball of the foot.